Good afternoon. Almost all state COVID mitigation tools were lifted about a year ago. So for many, COVID hasn't been top of mind for a while, but public health officials don't want you to forget what got us here. From mask mandates to mass vaccination centers to reopening the state, Illinois and the country are taking a big step forward in putting COVID behind us.
I couldn't be happier to announce today that all national and state COVID-19 related emergency declarations have finally come to an end.
Governor Pritzker marking the day by declaring May 11th Illinois Public Health and Healthcare Hero Day.
When I think back to those early days, there were a lot of heroes, but especially those who were working in hospitals directly exposed to the virus.
The end of the emergency declarations, however, will mean some changes for people. Medicaid recipients will now have to renew their coverage with the state, something they didn't have to do for the past 3 years. Still, some lasting COVID-19 mitigation efforts will stay, one being telehealth doctor appointments.
Those telehealth visits are now covered by insurance and Medicaid. That's saving money. It's adding convenience, especially for seniors and working parents, and keeping people healthier.
While the mood is a celebratory one, COVID hasn't disappeared, and it can still be deadly for older people and those with compromised immune systems.
COVID is still among us. People are still dying from COVID on a daily basis, but it is now endemic. In other words, most people have some form of immunity to COVID.
As a reminder of how far we've come over the past 3 years, more than 36,000 people in Illinois died from COVID. Hundreds of thousands were hospitalized. Now, with vaccines and a better knowledge of the virus, Chicago is seeing only 13 hospitalizations a day, and public health officials continue working to keep those numbers low.
We are in no way cutting back on monitoring or data work at the health department. We're continuing our wastewater and our variant surveillance. You can continue to go to chi.gov/COVID-. We'll update it every week. You'll be able to see what's happening.
Keeping up on vaccinations is key to keeping COVID in check.
Everyone over 65, even if they had a bivalent booster in the fall, should have another one now. If it's been more than 4 months, we know that the strength of your immunity begins to wane, begins to dip, and so that it's important to keep up to date with the vaccine.
Another thing that may be changing, vaccinations and tests may no longer be fully covered, so many may have to pay some out of pocket. There are, however, still places people can go to get vaccinated and tested for free, one being Stroger Hospital. In the newsroom, Eric Rung, WGN News.